All right. Let's check out Robert in Virginia, who has a prostate cancer question. Hey, Robert, thanks for the phone call. You are live.
All right. Merry Christmas. I want to ask you about the what would be the cheapest way to get started on this for this prostate?
Well, first of all, right, we don't treat prostate cancer. That's illegal. So we can't even intimate that we treat any type of cancer. And if you're not infuriated by that, you should be, because the only people that can treat cancer in the U.S. are the people that suck at treating cancer, the MDs. It's nonsense.
Right.
Now, in order to support and promote the structure and function of your immune system and to give the prostate some medical nutrition support, the recommendation would be 4 bottles of selenium a month. 4 bottles of selenium a month. 1 anti-aging healthy start pack. 1 anti-aging healthy start pack. And as much Z radical, Z like zebra radical, as you can afford.
Okay.
If it's a bottle every 2 months, a bottle every month, a bottle every day. Whatever's in the budget, spend that on the Z radical once you have those other bases covered. Now, remember, we're like Muhammad Ali with the rope-a-dope. It's kind of a 1-2 move, right? So we have to take the supplements, but we also then have to stop eating food that's gumming up the works. So you have to eliminate the 10 bad foods, period. No, then there's no working around that. Eliminate the 10 bad foods. Take these nutritional supplements. Keep your fingers crossed. Ask God for help. See what happens.
All right.
All right, Robert. Let me know what happens, man. Keep up the good work, and I appreciate you. I hope you have a very, very Merry Christmas. Talking to Robert from North Carolina, one of my favorite states in the United States. Hey, Robert, thanks for the phone call. You are live.
Yes, Dr. Glenn, thank you, and thank you for your show. We enjoy it very much. I am 61 years old, and as so many men my age, we've experienced, enlarged prostate and all the symptoms that go with it. And we've kind of dealt with it for a couple of years, and it kind of came to a head about 3 weeks ago. My blood pressure shot way up. And anyway, we went to the doctor. They did the catheter, kind of released the pressure, emptied the bladder. They put me on the generic form of Flomax and Proscar. And since that time, I mean, I've been doing better, and seem to be urinating a little better, and that type thing. And the urologist that they recommended to me, I went to see yesterday, and he said, he gave me an ultrasound, and he said, well, your bladder's still not emptying properly. And he said, the way I see it, he said, you got 2 choices. You can self-catheterize yourself for the rest of your life, or you can get the TURP operation.
Yeah.
He called it TURP, the acronym, and you know what that is, where they go in and scrape the excess tissue off the prostate. And I said, well, let me ask this. I said, I've only been on the medicine for about 2.5, 3 weeks. Don't you think it should have a chance to kind of work and all? And he said, well, it's probably not going to do much more than it's already done. He said, you really probably need to get that surgery. And so, I didn't like either one of those alternatives. And we just wanted to call. We have so much, respect for you and your opinion on these things. And
yeah. Well, I appreciate.
If you had see if you might have a recommendation.
Yeah. Guess what? Yeah, you bet I do. So look, I mean, this is just common sense, right? I mean, if you had mold in your basement, you wouldn't just paint over it. Or, you wouldn't just scrape it off of the concrete or, the tiles in your basement or the wallpaper. You wouldn't just scrape it off or paint over it. You would look for the source of the mold and fix it. Because where there's mold, there had to be water, and if there was water intrusion into the house, you got a problem. You better find that and fix it, or it's going to happen again. That's just common sense. It's no different with this condition. What these people overlook, because they're just trained in an old-fashioned, out-of-date method. I mean, they're trained in an old-fashioned, out-of-date method. I mean, it's so archaic, their method of looking at human anatomy and physiology. It is laughable, but because everybody in their profession does it, They think that it's just the perfectly fine, thank you very much. They have been deluded by their own mediocrity. Deluded by their own mediocrity. They're like colorblind art critics who don't even know that they're colorblind, and they go around criticizing art. Oh, yeah, that's a beautiful painting of the Mona Lisa. They don't know diddly squat about it because there's a whole bunch of stuff right in front of their face that they can't even see. So, if they go in and roto-rooter your prostate with the TURP surgery, which is what that basically is, they're going to, burn away and cut away and hack away the tissue that is impeding the ureter that comes out of your bladder that goes through the penis, and which is, how you eliminate urine from your body. But it's going to come back. It's going to come back because the condition that caused the prostate to become swollen in the first place is not fixed by the surgical procedure. It's no different than scraping off the mold in the basement. We need to get to the root cause of what made the mold be there in the first place, what made the prostate get enlarged in the first place. And remember, buddy, that it is never possible to unsurgery something, right? It's never possible to unsurgery something. It's always best to do a medical nutrition intervention for a number of months in non-life-threatening conditions first. Stick around. I'll tell you exactly what to do on the other side of the hard break. We have to nip this in the bud, right? So the single most common cause from our perspective of an enlarged prostate is not enough selenium. It's not enough selenium and consistent consumption of foods unwittingly. You're eating foods that are pro-inflammatory, and your body doesn't have enough nutrients to put out those fires. And so, everybody's got a weak link in their chain. Some people it's their lung, some people it's their heart, some people it's the bone, some people it's the joint, some people it's the prostate. That's really where genetics comes into play here, right? Because different people will have different weak links. And we haven't figured that out yet, but I see it all the time. There's some people with selenium deficiencies, boom, they get a lung symptom. Some people with selenium deficiencies, boom, they get a liver symptom. Some people with selenium deficiencies, boom, they get a prostate symptom. Who knew? Well, nobody knows. You just have to wait and see how it plays out. So the recommendation here, of course, eliminate the 10 bad foods. That's of maximum importance. If you are not up to that, then just do whatever the MDs tell you, because I can't help you. You must clean up your diet, number one. Stop eating the 10 bad foods. No whining. Not that you're a whiner. Number two, make sure you are consuming a minimum of 50,000 ORAC points. 50,000 ORAC points of antioxidants a day. 50,000 minimum, 100,000 would be better. 100,000 would be better in your case. Between 50 and 100,000 ORAC points of antioxidants a day, and you can do that either through supplementation, right, or food, or both. So you're going to have to educate yourself about the ORAC value of different foods. So just do a little Google search, ORAC food value or whatever, and you can see that, walnuts have more antioxidants than peanuts, and red wine has more antioxidants than white wine, and so forth and so on. So by making simple dietary changes, you can go a long way towards upping the ante with your antioxidants, which is, in fact, what is necessary here. All right, number three, how much do you weigh, Robert?
185.
All right, so per month, buddy, it's going to be 2 anti-aging healthy start packs, 2 anti-aging healthy start packs per month, 4 bottles of selenium per month, 4 bottles of selenium per month, and 2 bottles of Prost FX a month, 2 bottles of Ultimate Prost FX a month, and 4 bottles, if you can afford it, of Z-Radical a month. 4 Z-Radical, 2 Prost FX, 4 selenium, and 2 anti-aging healthy start packs, plus eliminate the 10 bad foods, right, and up the ante with your antioxidants. So let me do a little calculation here. If you do 2 anti-aging healthy start packs, that's going to give you 32. That's going to give you about 44,000 ORAC, right? All by itself, just with the anti-aging healthy start packs. And just with the anti-aging healthy start packs, 44,000. So you're going to need, 60,000 more ORAC a day. Do this for 90 days. And also make sure you get the lubricated catheters and have a nurse show you how to do it. Call me back every 2 or 3 weeks with a report. I will look forward to it.